In a news report from techtoday, the biggest monster is spreading and it kills 1.5 million people each year, and it's not the coronavirus. It begins with a mild fever and malaise, followed by a painful cough and shortness of breath. The infection prospers in crowds, spreading to people in close reach. Containing an outbreak requires contact tracing, as well as isolation and treatment of the sick for weeks or months. This insidious disease has touched every part of the globe. It is tuberculosis, the biggest infectious disease killer worldwide, claiming 1.5 million lives each year. Dr. Giorgio Franyuti said many patients with tuberculosis at the hospital were being misdiagnosed with COVID-19. Until this year, tuberculosis and its deadly allies, HIV and malaria, were on the run. The toll from each disease over the previous decade was at its nadir in 2018, the last year for which data are available. Yet now, as the coronavirus pandemic spreads around the world, consuming global health resources, these perennially neglected adversaries are making a comeback. COVID-19 risks derailing all our efforts and taking us back to where we were 20 years ago, said Dr. Pedro L. Alonso, the director of the World Health Organization's Global Malaria Program. It's not just that the coronavirus has diverted scientific attention from tuberculosis, HIV and malaria. The lockdowns, particularly across parts of Africa, Asia and Latin America, have raised insurmountable barriers to patients who must travel to obtain diagnoses or drugs, according to interviews with more than 24 public health officials, doctors and patients worldwide. Fear of the coronavirus and the shuttering of clinics have kept away many patients struggling with HIV, tuberculosis and malaria, while restrictions on air and sea travel have severely limited delivery of medications to the hardest-hit regions. About 80% of tuberculosis, HIV and malaria programs worldwide have reported disruptions in services, and 1 in 4 people living with HIV have reported problems with gaining access to medications, according to UNAIDS. Interruptions or delays in treatment may lead to drug resistance, already a formidable problem in many countries. In India, home to about 27% of the world's tuberculosis cases, diagnoses have dropped by nearly 75% since the pandemic began. In Russia, HIV clinics have been repurposed for coronavirus testing. Malaria season has begun in West Africa, which has 90% of malaria deaths in the world, but the normal strategies for prevention, distribution of insecticide-treated bed nets and spraying with pesticides, have been curtailed because of lockdowns. According to one estimate, a 3-month lockdown across different parts of the world and a gradual return to normal over 10 months could result in an additional 6.3 million cases of tuberculosis and 1.4 million deaths from it. A 6-month disruption of antiretroviral therapy may lead to more than 500,000 additional deaths from illnesses related to HIV, according to the WHO. Another model by the WHO predicted that in the worst-case scenario, deaths from malaria could double to 770,000 per year. Several public health experts, some close to tears, warned that if the current trends continue, the coronavirus is likely to set back years, perhaps decades, of painstaking progress against TB, HIV and malaria. The starting point in this ruinous chain of events is a failure to diagnose. The longer a person goes undiagnosed, and the later treatment begins, the more likely an infectious disease is to spread, sicken and kill. The more you leave undiagnosed and untreated, the more you will have next year and the year after, said Dr. Lucica Didiu, who heads the Stop TB Partnership, an international consortium of 1,700 groups fighting the disease. The infrastructure built to diagnose HIV and TB has been a boon for many countries grappling with the coronavirus. Gene Expert, the tool used to detect genetic material from the TB bacteria and from HIV, can also amplify RNA from the coronavirus for diagnosis. But now most clinics are using the machines only to look for the coronavirus. Prioritizing the coronavirus over tuberculosis is very stupid from a public health perspective, Didiu said. You should actually be smart and do both. Thank you for watching. If you have any opinion about this infectious disease, feel free to comment below. If you want to know more about COVID-19 vaccines update, please watch other videos in our channel which shows you the 6 most promising vaccines update for COVID-19. Do subscribe to our YouTube channel to receive more useful videos about health.